They called her reckless. They called her a troublemaker. And when she kept pushing, kept asking questions nobody wanted answered, they locked her in the basement of Hargrove Memorial Hospital and told her she was done. 29-year-old Emily Carter had 20 minutes alone in that basement before the shooting started. The first gunshot echoed through the ventilation shafts at 11:47 p.m. on a Tuesday. By midnight, 43 armed men had seized every floor of the building, patients on ventilators, a NICU with 11 infants, 312 people with nowhere to run. What the cartel didn't know, what no one at Hargrove had bothered to find out, was exactly who they'd locked down there. If this story hits you, follow along, hit like, and drop your city in the comments. I want to see how far this thing travels. The basement smelled like mildew and old bleach. A single fluorescent tube flickered above the storage rack where they'd left her, and Emily Carter sat on an overturned supply crate with her hands folded in her lap, staring at the door they hadn't bothered to lock from the outside. They hadn't needed to. The message was clear enough. You're finished here. She'd been at Hargrove Memorial for 14 months, long enough to learn which elevators were slow, which charge nurses cut corners, and which supply closet on the third floor had been logging a 15% inventory discrepancy every single week since she'd arrived. Long enough to know that the discrepancy wasn't a clerical error. The termination meeting had lasted 11 minutes. She'd counted. Director of Operations Warren Fuchs had done most of the talking, which was typical. He was a broad man in his mid-50s with a silver tie and the kind of practiced patience that wasn't actually patience at all. It was contempt with better posture. Beside him sat Dr. Renata Solis, Chief Medical Officer, who hadn't looked up from the table once. And at the far end, arms crossed, mouth flat, Security Chief Dale Pruitt, who had personally escorted Emily from the nursing floor 40 minutes earlier after she'd raised her voice in the middle of a shift handover meeting. Raised her voice was their phrase. What Emily had actually done was stand up and say out loud, in front of 6 other nurses and 2 residents, "Someone is pulling Schedule 2 medications out of the dispensary in batches that don't match any patient record. And I've submitted 3 incident reports in the last 6 weeks and nothing has happened, and I would like someone to tell me why." That was what had gotten her escorted out. In the termination meeting, Fuchs had used words like disruptive and insubordinate and pattern of behavior, and Emily had sat across from him and kept her face still and her hands flat on the table, because she had learned a long time ago, in places a lot more dangerous than this conference room, that the moment you show someone they've gotten to you is the moment you lose. "We've reviewed your incident reports," Fuchs said, "internally, and we found no evidence of the irregularities you described." "Who reviewed them?" A pause. "The appropriate parties." "I'd like to know which parties those were." Solis shifted in her chair. Pruitt's jaw tightened. "Emily." Fuchs leaned forward slightly, dropping the formal tone like a door coming off its hinges. "I'm going to be direct with you. We've had concerns about your behavior since month 2. You don't follow established protocols. You go around your supervisors. You filed more complaints than any other staff member in your tenure here, and frankly, the nursing floor doesn't function well when one person is constantly, "I found a patient last month who had been transferred off the oncology ward without any attending physician sign-off," Emily said. "The transfer paperwork had Dr. Solis's signature on it, but I checked with Dr. Solis's assistant and she had no record of approving it." The room went very quiet. Solis finally looked up. "That patient," Emily continued, "was transferred to a private facility in Crestdale with no insurance record and no family notification. I still don't know what happened to him. His name was Gerald Marsh. He was 61 years old and he was responding well to his 3rd round of treatment." Fuchs stood up. "This meeting is over." "I'm not finished." "You are, actually." He straightened his tie. "Security will escort you to collect your personal items. Your access badge will be deactivated by end of day. And I would strongly recommend against making any further allegations about Hargrove staff or operations, because at this point you are a terminated employee with a documented history of disruptive conduct, and anything you say will be received in that context." He said it pleasantly. That was the worst part, like he was recommending a restaurant. Pruitt walked her down to the basement personally, not to her locker, not to HR, but to the basement, to to a storage room in the sublevel where the facilities crew kept seasonal equipment and broken IV poles in cardboard boxes stacked 8 feet high. He told her someone would bring her things down. He told her she should wait there until her ride arrived. He closed the door. She sat in the dark for about 30 seconds before she found the light switch. Emily wasn't the kind of person who spent a lot of time feeling sorry for herself. She'd learned that somewhere around her second deployment, Kandahar, the bad winter, the forward operating base that had taken mortar fire 3 nights in a row and still needed to function as a medical station the next morning, you didn't get the luxury of sitting with your feelings when there was work to do. You filed the feeling away. You dealt with the work. You came back to the feeling later if it still seemed important. Most of the time it didn't. She'd spent 4 years as a combat medic with the 68th Medical Brigade before her honorable discharge at 26. 2 tours. One commendation she never talked about. She'd gone into nursing afterward because it was the closest civilian equivalent she could find, because she was good at it, and because somewhere in the back of her mind she still believed that if you were good enough and careful enough and honest enough, institutions would eventually function the way they were supposed to. She was starting to reconsider that. She sat on the crate and thought about Gerald Marsh. 61 years old, responding well to treatment, gone. She thought about the supply logs she'd photographed on her personal phone before HR could revoke her system access. The pattern was too consistent to be accidental. 50 to 80 milligrams of hydromorphone every Tuesday, logged against patient IDs that turned out to be either discharged or deceased. Someone was pulling opioids out of the dispensary using dead patients' records as cover, and someone with signing authority was making the paperwork disappear. She'd tried the compliance hotline twice. She'd emailed the state health board once, received an automated acknowledgement, and heard nothing since. She'd considered going to the press and decided to wait until she had something more concrete. She hadn't waited long enough. The ventilation shaft above her head made a sound. She looked up. Then she heard the first gunshot. It wasn't close, somewhere above her, maybe second or third floor, muffled by concrete and distance. But Emily had heard enough gunshots in enough context to know immediately what it was. One shot wasn't an accident. Then there was a second. Then a burst of 3. Rapid, controlled, not panicked, tactical. She was already moving. The storage room had a door that opened to a maintenance corridor. She'd noticed it when Pruitt brought her in. Old habit, cataloging exits. She'd never fully stopped doing it. The corridor ran east-west along the basement's north wall, and she knew from the hospital's layout. She'd studied the evacuation schematics during her first week, because she was exactly the kind of person who did things like that. That it connected to a secondary stairwell at the far end that came up behind the cafeteria on the ground floor. She moved fast and quiet, staying close to the wall. Above her she could hear feet, many feet, moving in a pattern that wasn't a panicked evacuation. Too organized, too spread out. Whoever was up there was fanning out by design. She didn't have her badge. She didn't have her phone. Pruitt had taken it during the escort, standard procedure, he'd said. She had her scrubs, her nursing clogs, and 4 years of muscle memory that did not include waiting in a basement while something bad happened above her. The maintenance corridor was dark, except for emergency lighting every 40 feet, dim amber strips near the floor that gave just enough visibility to move without tripping. She passed 2 mechanical rooms and a locked utility junction before she found the secondary stairwell. The door was heavy. She eased it open an inch and listened. Voices. Male. Not English. Spanish, and under it something else, a regional accent she couldn't place precisely, but she'd heard that cadence before in certain parts of the Sonoran corridor. She let the door close. Armed takeover. Multiple shooters. They'd come in organized, which meant this wasn't random, which meant they'd had inside help or inside information, or both. She stood in the stairwell alcove for exactly 12 seconds, making decisions. There was a nurse's station on the sublevel, used mostly by the overnight housekeeping supervisor. It was 40 feet back down the corridor. She'd seen it when she came in. If the emergency landlines were still active and they hadn't cut the hospital's internal communication lines yet, she went back. The sublevel nurse's station was barely a station, a desk, a battered monitor, a phone console, and a first aid cabinet that hadn't been restocked since sometime in the previous administration. The phone gave her a dial tone. Internal lines only, she confirmed when she tried to dial out and got nothing. She thought for a moment. Then she lifted the receiver and dialed the NICU nurses station on the 4th floor. She'd rotated through there twice in her first 6 months and remembered the direct extension. It rang twice. A voice answered, low and shaking. Hello? This is Emily Carter. I'm a nurse. I was on staff until tonight. Don't say my name. Don't repeat anything back. Are you locked down? A pause. Yes. We have men with guns on this floor. They came in through the east stairwell about 10 minutes ago. They haven't come in here yet, but they're in the corridor. How many patients do you have in the unit? 11 infants. 4 are on respiratory support. We have 2 nurses and 1 neonatologist. Lock your door. Push the supply cart against it. Don't open it for anyone who doesn't identify themselves with an internal code. Do you have an emergency call button? I don't know if it's connected. They may have cut the system. Assume they did. Stay low, stay quiet. I'm going to work on getting you help. Don't panic. Don't try to move the babies unless the room is actively compromised. Understood? Yes. A breath. Who are you? Someone who's going to fix this. Emily set the receiver down. She sat for a moment with her hands on the desk and looked at nothing. 11 infants, 3 on floors she hadn't reached. And somewhere above her, however many men with automatic weapons who had planned this well enough to walk into a hospital of 300 plus and take it in under 10 minutes. She opened the first aid cabinet. Inside, bandage rolls, a blood pressure cuff, 2 pairs of nitrile gloves, a tourniquet, a pen light, and a small roll of medical tape. She put the gloves in her left pocket, the tourniquet in her right, and clicked the pen light twice to confirm the battery. Then she went back to the maintenance corridor and started moving. The tunnel system under Hargrove Memorial was older than the building's current incarnation. The hospital had been expanded twice, in 1987 and again in 2009, and both times the renovations had added to the sub-level infrastructure without fully replacing what was already there. The result was a network that the facilities team used daily and that nobody else in the building knew particularly well. Emily had made it her business to know. She'd befriended one of the senior maintenance engineers in her second month, a man named Osvaldo, 63, who'd worked the sub-level for 20 years and walked it during lunch breaks the way some people walked parks. He'd shown her the full layout over 3 separate conversations, mostly because she'd asked and because nobody else ever had. People, he'd told her, didn't think buildings were interesting. She'd told him she thought they were basically the same as bodies, plumbing and electrical and structural load, and if you understood how they were supposed to work, you'd know right away when something was wrong. He'd laughed and drawn her a map on the back of a work order. She still remembered most of it. The east tunnel ran under the ambulance bay and connected to a utility access point behind the ER supply room. That meant she could come up inside the ER without entering through any main corridor. And the ER, if the armed men had come in through the hospital's public entrances, was likely at the end of their control sweep, not the beginning. She had maybe a window. She moved through the tunnel at a low jog, counting paces. Eek. The ER supply room was dark. She came up through the floor hatch, which hadn't been locked since Osvaldo's last audit. A maintenance note had been in the system for months, something else that had been filed and ignored, and pressed herself against the shelving for 10 seconds, listening. No footsteps in the immediate room. Voices somewhere past the double doors, but muffled, and what she heard under them made her stomach clench, crying. Patients. People who'd been there for their own emergencies before a different kind of emergency arrived. She found what she needed on the supply shelves without a light. Her hands knew what an IV kit felt like, what a trauma dressing felt like. She loaded her scrub pockets with what she could carry and moved to the door. Through the narrow window, she could see the main ER bay. 8 patients she could count. 2 in beds along the south wall, 3 more slumped in waiting chairs, 1 man in a neck brace on a gurney, 1 woman who appeared to be post-surgical, 2 armed men near the main entrance, rifles loose but present, scanning. Neither of them was looking at the supply room. She identified the nursing alcove, unoccupied, phone console visible, and the relative blind spot between the second supply cart and the medication cabinet, 12 feet across open floor. She waited. The nearer gunman turned toward the entrance. She went, She covered the 12 feet in 6 steps and dropped behind the supply cart in the same motion, landing on both knees, already reaching for the phone console with one hand. Internal dial tone. She dialed the security desk, not because she expected help from security, but because the security desk had a radio board that was hardwired to the hospital's emergency broadcast system. Deadline. They'd either cut it or taken the desk. She switched approaches. Hospital operator extension. Also dead. The pharmacy direct line, she'd called it enough times to know the number, rang twice and connected. A man's voice, also low, also frightened. Hello? Who is this? Dominic, night pharmacist. Who's this? Emily Carter, third floor nursing. I was on staff until tonight. She was adapting her introduction on the fly. She was staff until tonight. Technically true, and she didn't have time to explain the rest. Are you secured? The dispensary gate is locked. There are 2 men outside in the corridor, but they haven't tried to come in. I have 1 tech with me. Listen carefully. I need you to activate your controlled substance diversion alert. The full protocol. That triggers a federal notification through the DEA monitoring system. Do you have access? Yes, but that's for internal theft. It's not. It links to a federal emergency network and it has a geographic beacon. Right now it's the best signal we've got. Do you have cause? A pause. She could hear him thinking. Someone broke into my dispensary access cabinet last week, he said slowly. I reported it and nothing happened. That is more than enough. Do it now. She didn't wait to hear him confirm it. She put the receiver down and looked across the ER bay again. The surgical patient on the south wall was awake. An older woman, maybe 65, with a hospital bracelet and an oxygen cannula that had slipped. She was conscious enough to be looking around with the particular expression of someone who understood exactly how bad this was and was trying not to show it. Emily moved toward her, still low, working around the cart. Don't react, Emily said quietly, crouching beside the bed rail. I'm a nurse. Keep your eyes forward. The woman, her wristband read Patricia Dunn, 67, post-hip replacement, cut her eyes sideways without moving her head. How many of them are there? I don't have a full count. At least 8 on this floor. They took our phones, made everyone hand them over when they came in. Patricia's voice was steady in a way that suggested she'd been steadying it for a while. 2 people tried to leave through the ambulance bay, and they were brought back. Were they hurt? Not badly. Roughed up. She paused. Young man in the neck brace. He has a cervical injury. He cannot be moved without proper support. I've been watching them to make sure they leave him alone. Emily glanced at the man in question. He was awake too, eyes fixed on the ceiling, not moving. She noted the brace model, the positioning, the way his hands were arranged. Someone had done the initial stabilization correctly. Do you have any medical background? Emily asked. Patricia looked at her properly for the first time. I was a trauma nurse for 31 years, retired 4 years ago. Emily almost laughed. Okay, here's what I need from you. She spent the next 18 minutes working. Patricia became her eyes on the south end of the bay while Emily moved along the north wall, checking patients, administering what she could from what she'd taken from the supply room, and methodically building a picture of what she was dealing with. 3 patients were stable and mobile if it came to that. 2 were not. The man in the neck brace absolutely could not be moved without a collar, a backboard, and at least 2 people who knew what they were doing. The 2 gunmen at the entrance didn't come into the bay. They were watchers, not rovers. Their job was containment at the threshold. That told her something about the operations structure. They'd divided the building into zones with designated personnel per zone, which was organized, which was professional, which was not good news in terms of who she was dealing with, but was useful information in terms of predicting how they'd move. At the 18-minute mark, something changed. She heard it before she saw it. A different kind of voice, coming from the main corridor outside the ER. Not the flat, watchful tone of the threshold guards. Something sharper. Someone giving orders. She pressed herself into the shadow of the supply station and watched through the bay window as a 3rd man passed in the corridor, taller than the others, moving with the unhurried authority of someone who didn't need to hurry, wearing civilian clothes with a radio clipped to his chest. He was speaking in rapid, clipped Spanish, and he wasn't looking into the ER bay. He was looking at his phone. Emily watched him pass. She recognized what she was seeing, not the man. She didn't know his face, but the way he moved, the way the other men's posture shifted fractionally when he went by, the way the nearest guard's eyes tracked him, the way subordinates track command-level authority without meaning to. She'd seen that dynamic enough times in enough places. She looked at his phone hand. He was sending something, or receiving it. She thought, there's an inside communication network, and whoever's at the center of it is coordinating something that hasn't happened yet, which meant she had a window that was getting shorter. Hope. She found the hospital's maintenance radio on the third try. Osvaldo kept a unit in the sub-level workshop that was tuned to both the facility's channel and, as a backup from some old protocol, the hospital's emergency management frequency. She'd come back down through the floor hatch to get it, moving fast, knowing she was burning time she didn't have. The emergency management frequency was a relic. Hargrove had switched to a digital dispatch system in 2019, and the analog band had been functionally abandoned. But old emergency bands didn't disappear. They just went quiet. And the right receiver, with the right knowledge, could still hear them. And more importantly, they could still transmit. She keyed the radio on the emergency frequency and spoke clearly, once. This is Emily Carter, inside Hargrove Memorial Hospital in Delwood. Armed takeover in progress. Minimum 40 hostiles. 300-plus civilian hostages, including NICU, with 11 infants. Requesting federal tactical response. Repeat. Emily Carter, Hargrove Memorial, Delwood. Armed takeover. NICU compromised. Federal assistance required. She released the key, sat in the silence of the sub-level workshop, and listened to the static. Then she went back to work. She was on the second floor, having come up through the east stairwell, in a gap between patrols she'd timed from 2 floors below, when she found the man bleeding out in the linen closet. He'd gotten in through a window, based on the glass still in his left arm. Mid-40s, heavy-set, a hospital ID clipped to his shirt. She squinted at it in the penlight's narrow beam. Facilities. His name was Thomas. He'd taken a grazing shot across his right flank, deep enough to bleed seriously but not deep enough to have hit anything vital, which was the only reason he was conscious. Don't move, she said, already pulling the trauma dressing from her pocket. He grabbed her wrist. Who are you? Nurse. Let go. He let go. She pressed the dressing against the wound and guided his hand to hold it. Maintain pressure. Keep it firm. How many of them are there? Same first question as Patricia. People defaulted to counting when they were frightened. I'm still working on that. She was also working on the secondary dressing, taping it in place with the medical tape from her pocket, her hands moving without needing to consult her brain for instructions. How did you get to the second floor? I was in the facilities office when it started. I tried to get to the exit through the service corridor and someone shot at me. I went up instead of out. He swallowed. There are people up here, patient rooms. They have all the patients in their rooms. Are they mobile? Do you know? East Wing's a step-down unit. Most of those patients are recovering from procedures. Some could walk, maybe. The West Wing has the post-op cases. He winced. You're the nurse they were talking about. Emily looked up. What? On the radio. I heard it before this happened, or right when it was starting. They had the overhead paging going for a minute and then it cut out. Someone paged the nursing supervisor and said something about the nurse who'd been sent to the basement, that you were causing problems. He met her eyes. You're the one they locked up. She looked at him for a moment. Then she finished taping the dressing and stood up. I need you to stay in this closet, she said. Don't open the door unless you hear a clear, all clear over the building PA. If someone who isn't me comes through that door, act unconscious. Do you understand? He nodded. She was already at the door, listening. Outside, the second-floor corridor was dark, except for the emergency lighting and the narrow strips of illumination under patient room doors. She could see 2 of the armed men at the far end, East Wing, standing near the elevator bank. They were talking quietly. She counted the distance. 80 feet, easy line of sight, no cover between her and the nearest patient rooms except a crash cart near room 214. She was mapping a path to the crash cart when her penlight caught something on the floor. a thin, dark line of reflection. She crouched and touched it. Liquid. Pharmaceutical. The faint synthetic smell was distinctive, and she'd been around dispensaries long enough to identify it. She followed the trail with the penlight for 3 feet until it disappeared under the door of the supply room across from 214. She straightened up slowly. Supply room. 2nd floor. The exact location she'd flagged in her 3rd incident report as a secondary access point for the medication irregularities. She'd noted that the keypad record showed after-hours entries on Tuesday nights, with credentials that didn't match any scheduled staff. Tonight was Tuesday. She looked at the supply room door. She looked at the 2 armed men at the end of the corridor. She thought about the man on the phone she'd seen downstairs, the one moving with command authority, and the way he'd been looking at his screen. And then she understood what the cartel was actually doing here. This wasn't a takeover. It was a pickup. Whatever had been building in this hospital for months, the missing medications, the unauthorized patient transfers, the paperwork with forged signatures, this was the collection point. The armed seizure wasn't the crime. It was the cover for the actual crime. The thing that made it possible to walk out of a hospital supply room with a quantity of product that would explain why someone had needed months to accumulate it. And the people who had let it happen, who had looked at her incident reports and filed them in whatever drawer you file things in when you want them to disappear, were somewhere in this building right now. She was still working through the implications when her radio clicked. Static, and then, faint but clear through the background noise, a voice she didn't recognize. A structured response code, the Federal Emergency Management frequency. Someone had received her transmission. Someone was coming. Emily clicked the radio twice, the old field acknowledgement, 2 clicks meaning received and understood, and pressed herself against the wall as one of the gunmen at the end of the corridor turned his head in her direction. She didn't move. He turned back. She let out a slow breath and began working toward the crash cart. The crash cart was locked. Of course it was locked. Emily crouched behind it anyway because it was cover, and because she needed 3 seconds to think, and she used those 3 seconds to run through what she actually had. 2 trauma dressings deployed, 1 tourniquet still in her pocket, a penlight, a pair of nitrile gloves, a radio the size of a paperback novel, and approximately 40 feet of open corridor between her and the supply room that had just become the most important room in the building. She also had the knowledge that federal assets had received her transmission, which meant she had a clock she couldn't see running toward an arrival she couldn't predict. Could be 20 minutes, could be 90. In a hostage situation with armed men who had a specific objective and a reason to move fast, 90 minutes was a number she didn't want to think about too carefully. She looked at the supply room door again. The keypad beside it was standard hospital issue, the kind with a 6-digit code that facilities staff could override with a master pin. She didn't have the master pin, but she knew that Osvaldo had taped a laminated card with the override codes to the underside of his workbench in the sub-level, because she'd watched him use it once and asked about it, and he'd shrugged and said the digital system was fine until it wasn't, and he'd rather have backup, which meant going back down, which meant losing time on the 2nd floor. She was still calculating when the supply room door opened from the inside. Emily went flat against the back of the crash cart and did not breathe. 2 men came out. Neither of them looked like hospital staff. They were carrying a hard-sided case between them, the kind with reinforced latches and a foam interior. She'd seen similar cases in field medical storage, equipment transport, pharmaceutical cold chain logistics. This one was large enough to hold 8 to 12 liters of product in separated packaging. They carried it like it had weight and value, and they moved toward the east stairwell with the efficiency of people completing a task they'd rehearsed. Behind them, holding the supply room door and watching the corridor while the other 2 moved, a 3rd man. This one had a radio and a sidearm, and he scanned the hallway with the disciplined patience of someone covering a withdrawal. His eyes went across the crash cart without stopping. Emily watched him through the 2-inch gap between the cart's base and the floor. After 45 seconds, the 3rd man let the door close and followed his team to the stairwell. She waited 10 more seconds. Then she moved to the supply room. What? The master override panel for the door was on the inside. Once you were in, you didn't need a code to look at the access log. Standard design because facilities staff needed to audit the logs without an extra credential. Emily found the log reader in 30 seconds and scrolled back through the past 48 hours. 31 entries in the last 2 days. That was not normal for a second-floor supply room that primarily stocked IV fluids and wound care materials. Cross-referencing the badge IDs against what she knew, and she'd spent enough time in this hospital to know which badge numbers corresponded to which staff. 3 of the 31 entries came back to identifiers she didn't recognize at all. Ghost credentials. Either the system had been compromised or someone had generated access badges that weren't in the HR roster. The most recent entry was time-stamped 11 minutes ago. Badge ID 7731, duration 4 minutes, access granted. Badge 7731 was not in any staff directory she'd ever seen. She photographed the screen with the camera she didn't have, which meant she stood there and memorized what she could. The badge IDs, the timestamps, the duration patterns. 7 entries on the previous Tuesday, 6 the Tuesday before that. A rhythm that matched exactly what she'd described in her 3rd incident report, the one that Fuchs had told her the appropriate parties had reviewed and found unremarkable. She let the door close behind her and stood in the corridor. Down the hall, the 2 watchmen near the elevator bank hadn't moved. She could hear one of them on a radio now. Short bursts of transmission, responses she couldn't make out. The body language was wrong for a routine check-in. One of them was leaning forward slightly, head tilted, the way you do when you're receiving instructions that require concentration. Something was changing. Bumped. She went back down through the east stairwell, carefully, stopping at each landing to listen before continuing, and was back in the sub-level workshop within 4 minutes. She found Osvaldo's laminated card exactly where she'd remembered, taped under the second shelf of the workbench, curled at one corner from age and workshop humidity. She didn't take it. She memorized the master pin and put the card back. While she was under the workbench, she also found something she hadn't been looking for. A hospital radio, second model, older than the one she'd been carrying, still in its charging dock. She checked the battery, 60%, and switched it to the emergency management frequency. If there was incoming federal response coordinating on that band, she would hear it. She clipped the second radio to her waistband, set it to receive only, and headed back toward the stairwell. The sublevel was quieter than it had been an hour ago. That was bad. In her experience, quiet in a situation like this didn't mean things were calming down. It meant things were consolidating, and consolidation ahead of a specific objective meant the objective was getting close to completion. They were moving product out. She'd seen 2 men with a hard case going toward the east stairwell, which connected to the ambulance bay, the one exit point that had vehicle access and a loading dock. If she was running this operation, the ambulance bay would be her extraction point. Cover vehicle, interior access, designed for rapid loading of large items. She needed to slow that down. Not stop it. She wasn't equipped to stop it, but slow it enough that federal assets arrived before the extraction completed. She thought about what she had available. The sublevel mechanical room housed the hospital's emergency power systems, the generator that kicked in during outages, the transfer switches, the electrical distribution panels. Emily had been in there once with Osvaldo during a scheduled maintenance walk. She remembered 2 things, the panel layout and the fact that the ambulance bay's dedicated electrical circuit was labeled on the distribution board in red marker because someone on the facilities team in 1994 had decided color coding was useful and nobody had ever updated the system since. She found the mechanical room in 90 seconds. The panel was where she remembered it. The ambulance bay circuit was on breaker 17, labeled in faded red, AMB bay/dock exterior. She looked at it for a moment. Cutting the circuit would kill the lights on the dock and disable the exterior door actuators. The bay doors could still be opened manually, but that would take time. Whoever was running the extraction would need to find someone who knew where the manual release was, which wasn't intuitive, and in the dark it was worse. She was guessing 3 to 5 minutes of delay, maybe more if they weren't prepared for it. 3 to 5 minutes was not nothing. She flipped breaker 17. The ambient hum of the building changed slightly. A small, almost imperceptible shift in the electrical background noise that you'd only notice if you'd been listening for it. She stood in the mechanical room and waited for a reaction from above her. It came faster than she expected. Radio traffic, multiple voices, elevated pitch. Not panic, but urgency. The sound of people encountering an obstacle they hadn't planned for. She heard feet moving, rapid, purposeful. Someone going to find the problem. She had 3 to 5 minutes, probably less. She went. The east stairwell came up behind the ER, which put her near the ambulance bay on the ground floor. She moved through the supply room entrance she'd used before, the floor hatch, still unsecured, and came up inside just as someone on the other side of the ER bay double doors started pounding on them from the corridor. She froze. The pounding stopped. Voices again, rapid exchange in Spanish. Then something she didn't expect. A second voice, responding in English. American accent, the kind that came from somewhere in the Midwest and had spent time getting flatter and more professional over years of institutional work. She knew that voice. She moved to the bay window and looked into the corridor. Dale Pruitt was standing in the hallway talking to the man with the command radio, the same one she'd seen earlier, the one whose posture made everyone around him slightly smaller. Pruitt had his hands up, palms out, not in the way of someone surrendering, but in the way of someone negotiating. He was speaking quickly and quietly, and the command radio man was listening with the particular stillness of someone deciding whether what they're hearing is useful. Emily watched Pruitt's hands. He wasn't restrained. He wasn't scared. Or he was scared, but underneath the scared was something else, something that looked a great deal like, "Please, I've done everything you asked." The pieces finished assembling themselves. Pruitt had been inside on this. Not just passively complicit, actively operational. He'd been the one running security protocols at a hospital where someone was stealing pharmaceutical product for months without consequence. He'd been the one who had walked her to the basement tonight instead of following standard termination procedure. He'd been the one who knew exactly where she was. He'd put her somewhere safe. Safe for them, not for her. Somewhere she'd be out of the way during the part of the evening when being a witness would have been the most dangerous thing possible. She watched his face as he talked to the man with the radio, and then the man with the radio looked up. He looked at the ER bay window. She pulled back from the glass. Her heart rate had been steady all night. She'd worked through enough real emergencies that her body had learned not to waste adrenaline on fear. But it spiked now, briefly, in the 2 seconds where she didn't know if he'd seen her face or just the reflection of the emergency lighting. She waited. No footsteps toward the bay. No raised voice. No door. She let herself breathe. Atsem. The ambulance bay was chaos. She could hear it from 20 feet away. The sound of the bay door being operated manually, which produced a grinding mechanical shriek because the manual release on a hydraulic hospital door was not designed for quiet, and whoever was operating it didn't care. Above that, more radio traffic, overlapping, the kind of frequency collision that happened when multiple parties were transmitting at the same time without coordination. Something had changed in the timeline. They were accelerating. She came into the bay from the interior supply corridor, a narrow passage between the ER and the loading area that staff used to move equipment, and pressed herself behind a parked gurney just inside the bay door. 2 vehicles in the bay. One she recognized as a hospital transport van, the kind used for patient transfers, white, marked with the Hargrove logo. The other was unmarked, a dark panel van she'd never seen, parked with its rear doors open and backed against the loading dock. 3 men loading the panel van, 2 cases already inside. A 4th man watching the interior door, the one she was behind. The interior watcher was 15 feet away, facing in her direction, and he was looking at his phone screen while he watched, which was the kind of situational awareness failure she'd seen in nervous operators who were trying to do 2 things at once. She counted. The man at the dock door, the 3 loaders, and based on the radio traffic, at least 2 more she couldn't see, somewhere in the vehicle bay's extended corridor. 6 total in the immediate area, and they were close to done. She could see it in the efficiency of the loading. These men had done this before, the stacking and the latch and move of it, and they were down to the last of what they'd come for. She looked at the panel van's rear doors. If she could close those doors from the outside, shut them, and engage the external latch before they finished loading, she could lock in at least one of the loaders. That wasn't enough to stop the operation, but it would. One of the men shouted, Then another. Not at her. At each other. And then at the door they were trying to get closed on the dock, which wasn't responding because she'd cut the power and the manual override was apparently stuck. The three of them crowded around it, and for a moment all three loaders had their backs to the van interior. Emily moved. She covered the 15 feet to the van's side at a diagonal that kept her outside the interior watcher's direct sightline. He was still looking at his phone mostly, though his head came up once and she had to stop and press against the transport van for 2 full seconds while he scanned without focus before going back to the screen. She made it to the panel van's side, reached the rear door hinge. The external latch was a standard cargo lock, spring-loaded, 2-position, the kind that clicked shut when you swung the door. She didn't have to touch the interior. She just needed the door. She was reaching for it when her radio, the second one, set to receive only on the emergency frequency, broke squelch. A voice, male, flat, professional, the specific cadence of tactical communication. Hargrove Memorial, this is Echo 7 Actual. We are 8 minutes out. Please confirm your position. She grabbed the radio and clicked it twice, remembered she was on receive only, found the transmit switch, clicked it 3 times. Echo 7, Carter. Ground floor, ambulance bay, southeast interior. Hostiles extracting via panel van, rear dock, bay door manually open. Recommend approach from north perimeter. A pause. 2 seconds. Carter, confirm. Emily Carter, 68th Medical? She almost answered. She stopped herself because she was in an open bay with 6 armed men within 40 feet, and if any of them were monitoring this frequency, she'd just handed them her position. She clicked twice. Received. Copy, the voice said. Hold position if able. We are 8 minutes. 8 minutes. She put the radio on her belt and looked at the 3 men at the dock door, who had given up on the latch and were now propping the door open manually with what appeared to be a spare gurney wheel block, improvising, which meant Pruitt, or whoever was managing this, hadn't briefed them on manual procedures, which told her the inside cooperation only went so far. She looked at the panel van's rear doors again. Then one of the loaders turned around, and he saw her. He didn't shout immediately. There was a half-second delay, the processing lag that happened when the brain encountered something it hadn't expected. The kind of pause she'd seen before at close range in places where pauses had specific consequences. She was already moving in that half-second, not toward him. Sideways, back behind the transport van, her shoulder hitting the vehicle panel with more force than she'd planned for, her elbow taking the impact and sending a bright wire of pain up to her shoulder that she cataloged and set aside because now he was shouting. The interior bay went loud. She scrambled around the front of the transport van and came up on the driver's side, keeping the vehicle between her and the men behind her. The driver's door was unlocked. She got it open, got inside, pulled it shut, locked it, 2 seconds, 3, and found the keys in the ignition. Because of course the keys were in the ignition. Because it was a hospital transport van in a locked bay, and whoever had parked it here last had followed the same logic as every facility shortcut she'd ever encountered in this building. The men outside were at the passenger window now. She didn't look at them. She looked at the dock door, propped open, the dark beyond it, where the exterior loading area connected to the ambulance circle. She started the van. The engine turned over and one of the men slammed his palm on the hood, and she looked at him through the windshield, and he had a weapon coming up, and she put the van in reverse and stepped on the gas before she'd fully processed the decision to do it. The van went backward, fast, and the man with the weapon had to jump sideways, and the rear bumper caught the gurney wheel block in the dock door and knocked it free. The hydraulic door began to close, slowly, with that same grinding shriek of the manual system resetting, and she was out of the bay and in the exterior ambulance circle before anyone had gotten organized enough to follow. She hit the brakes, put the van in park, looked at the bay door closing behind her. The radio on her belt clicked. Carter, this is Echo 7. 6 minutes. Say status. She was breathing harder than she'd meant to. Her elbow throbbed. She became aware, in a delayed and peripheral way, that her hands were shaking. Not much, the small, controlled tremor of a body that had spent the last 90 minutes running on cortisol and focus, and had just now gotten the first 30-second gap to notice what that had cost. She breathed through it. In for 4, hold for 4, out for 4. A thing she'd learned in a different context a long time ago, for different reasons. Echo 7, she said into the radio. Status is, extraction vehicle is blocked. One interior bay door closed. Approximately 6 hostiles in bay, unknown count in rest of building. NICU is 4th floor, east wing, contained but unharmed. My position is exterior ambulance circle, south side. Copy, Carter. We have visual on the building. Hold position. She looked at the hospital's exterior. The lit windows, the dark ones, the shadow of the 3rd floor where she'd left Tomas bleeding in a linen closet with instructions to act unconscious. She looked at the 4th floor, where 11 infants were in a locked unit with 2 nurses and a neonatologist who had been trying not to breathe loudly for the past 90 minutes. She was not going to hold position. Carter, the voice said, reading her silence, I need you to stay in the vehicle. I have wounded on the 2nd floor in a vulnerable NICU unit on 4, she said. I have a man in a linen closet near room 214 with a GSW to the flank, stable but not secured. I cannot hold position. A pause. She could hear the operational math happening on the other end. You armed? No. Another pause. You're not armed. You're in a hospital van and you want to go back inside. Yes. The voice on the radio was quiet for a moment. When he came back, something in his tone had shifted. Not softer exactly, but recalibrated, the way people recalibrate when they realize they've been thinking about a situation wrong. Give me the ward layout for the 4th floor. She told him everything she knew. When she finished, he was quiet for 4 seconds. Then, copy. Do not approach the NICU until you hear our breach on the ground floor. Once the ground floor is engaged, their command structure will fragment and you'll have a window. Do you understand? Yes. 4 minutes, he said. Can you give me 4 minutes? She looked at the hospital, looked at the 4th floor windows. 4 minutes, she said. She didn't move the van, but she kept the engine running and she kept her hand on the door handle and she watched the building and counted. And somewhere on the 2nd floor, Tomas was alone in a linen closet. And somewhere on the 4th floor, a NICU nurse was holding a locked door shut with a supply cart. And somewhere inside the building, Dale Pruitt was standing in a corridor talking to a man who had just realized that his extraction was compromised and his timeline was broken, and the thing he hadn't planned for, the thing nobody in that building had ever taken seriously, was already 2 steps ahead of him. She was still counting when the lights on the north perimeter of the parking lot went dark all at once, and she heard, very faintly, the sound of vehicles moving without headlights. They came in without lights and without sirens, and with the particular organized quiet of people who had done this enough times that the doing of it had become unremarkable. Emily counted 4 vehicles from the ambulance circle, 2 dark SUVs and what looked like a pair of unmarked vans, moving in a coordinated spread across the north and west perimeters that told her they'd already mapped the building's exterior. No staging delay, no equipment check visible from where she sat. They'd been staged already. They'd been moving before she'd made the transmission, or very shortly after, which meant the DEA diversion alert from the pharmacist had landed somewhere real and someone had decided to move before they had full confirmation. That was unusual. That told her something about the scale of what Hargrove had been involved in. Her radio clicked. Carter, we're at the perimeter. Ground breach in 90 seconds. North entrance and east loading dock simultaneous. When you hear the breach, you have a window. Copy. One more thing. A brief pause, like the speaker was deciding something. This is Commander Lyle Harmon, DEA Tactical. I pulled your service record 20 minutes ago. Just wanted you to know who you're working with. She didn't say anything for a second. People didn't usually lead with that. Harmon, she said. Nurse's station, 4th floor, east wing. The door with the supply cart behind it. That's your priority after the NICU. Already on the list, 90 seconds. She got out of the van. Check. She went in through the same floor hatch she'd been using all night. The ER supply room, sublevel, up and through. Because she knew the route and because the ground floor was about to become a tactical engagement zone, and she had no business being anywhere near the entry points when that happened. She moved fast. Her elbow still ached from the impact on the transport van, and she'd stopped fully registering it somewhere around the 2nd stairwell, which wasn't a good sign physiologically, but wasn't her most urgent problem. She was at the east stairwell door, second floor landing, when the breach happened. It was not subtle. A concussive thump from the north side of the building. A door charge, she recognized the sound. A specific flat percussion that was different from a gunshot in a way that was hard to articulate but immediately identifiable if you'd heard both enough, followed almost simultaneously by a second charge from the east. Then, for about 4 seconds, nothing. The held breath before the exhale. Then it went loud. Gunfire, multiple weapons, from at least 2 directions. Shouting, in Spanish and in English, the English in the clipped command register of tactical operators who were communicating position and movement and not explaining themselves to anyone. She heard feet above her, running, not the organized spread of earlier, but the fractured movement of people whose plan had just encountered something they hadn't modeled. The second-floor corridor outside the stairwell door went from 2 watchmen to 0 in the span of 20 seconds. She tracked it through the door window, watched them move toward the stairwell to her left. The main one, the one going down toward the ground floor, which left her side clear. She went. Room 214 was where she'd left it. She knocked twice, the way you knock when you want someone to know it's not a threat. Not hard, not fast. Tomas! It's Carter. Silence. Then, how do I know? Fair question. You called me the nurse they locked in the basement. I told you to act unconscious. The door opened 4 inches, showing one eye and the edge of a face that had gone considerably paler than when she'd left him. He was still pressing the dressing to his flank, which was the right instinct, though the pressure had gone uneven, and she could see through the gap that the dressing had bled through at the lower margin. She pushed the door the rest of the way and crouched beside him. The secondary bleed was superficial. The wound hadn't opened further. The original dressing had just reached saturation. She replaced it with the last trauma dressing from her pocket and retaped the whole construction with the remaining medical tape, pulling tight enough to matter. Feds are in the building, she said while she worked. Ground floor, moving up. Don't go into the corridor until you hear an all clear on the PA. If someone in tactical gear comes through that door, hands visible, no sudden movement, you say, civilian, injured, non-combatant. Repeat that. Civilian, injured, non-combatant. Good. She stood. Keep pressure. Don't fall asleep. Blood loss? You need to stay conscious. He grabbed her wrist again like before. Different grip this time. The 4th floor, he said. I heard them talking before it got loud. They were saying something about the 4th floor, that they had a problem up there. What kind of problem? I don't know. Something about a patient. Someone who wasn't supposed to be there. He let go. I don't know if it matters. It mattered. She didn't know how yet, but it mattered. Someone on the 4th floor who wasn't supposed to be there. In a building that had been moving patients without paperwork for months. In a hospital where the bed assignments on at least one floor had been running off books. That was not a detail she could file away. She went back to the stairwell. The 4th floor was different. Below her, the tactical engagement was moving north to south, ground floor, and then first. The gunfire sporadic now rather than sustained. The initial resistance breaking down into isolated pockets, which was a pattern she recognized. The pattern of a command structure that had lost its coordination and was operating on individual initiative rather than plan. Harmon's team was fast, and they were organized, and the cartel, whatever its advantages in numbers and preparation, had not planned for a breach from 2 simultaneous vectors within 90 seconds of each other. The 4th floor, though, was quiet. Too quiet, in a way that was different from the quiet she'd encountered on the 2nd floor earlier. That had been the quiet of people hiding. This was something else, a deliberate absence, the feeling of a space that had been recently and purposefully vacated. She came through the stairwell door onto the 4th floor and stopped. The corridor was empty. The East Wing nursing station, where she'd called from hours ago, was dark. The supply cart she'd told them to put behind the door was visible through the unit window, still in place, but she could see through the unit's interior window that the nurse's station inside was empty. The NICU door was open. She crossed to it in 8 steps and went inside. The infants were there. All 11 in their isolates, monitors running, respiratory support functional. not a single alarm sounding. She did a sweep of the unit in under a minute, checked each isolette, read the monitor outputs. Saturations were appropriate, heart rates within range. The 4 on respiratory support were cycling correctly. Whoever had been here with them had taken care of them before leaving. The nurses were gone. The neonatologist was gone. She found the note on the nursing station counter, written on a piece of monitoring tape in ballpoint pen, in the cramped handwriting of someone writing fast. Moved to stairwell B per instructions from ground floor. Baby's stable. Do not move. Isolette 7 without additional respiratory support. Stairwell B was the west stairwell, the tactical team's secondary access route. The nurses and the physician had been evacuated. Someone on Harmon's team had gotten to them. Emily let out a breath that came from somewhere deeper than her lungs. She stood in the NICU for a moment with the sounds of 11 monitors around her and the distant, muffled noise of the engagement continuing below, and she let herself be still for the first time in 2 hours. Her elbow hurt. Her knees hurt from the repeated transitions between running and crouching and climbing. The sole of her left clog had a crack in it that she hadn't noticed until now, when the silence was available to notice things in. She'd been running on a very specific kind of fuel, the kind that didn't ask permission and didn't announce itself, and she could feel the edges of it now in the way her hands had gone, from a small tremor to a dull, heavy stillness. Then she heard the sound from the room at the end of the east corridor, and the stillness went away. It was a voice. One voice. And she couldn't make out the words, but the cadence was wrong. Not the controlled transmission of tactical communication, not the urgent whisper of someone hiding. It was measured, patient, the cadence of someone talking to a person they had leverage over. She moved toward it. The room at the end of the east corridor was a private suite. Hargrove had 4 of them on the 4th floor, the kind of room that cost 4 times as much as a standard bed and came with an upholstered chair and a window that actually opened. The door was closed. She pressed herself to the wall beside it and listened. The voice was Pruitt's. Understand what I'm telling you. The situation has changed. The people you work for are going to want confirmation that the transfer was completed before they move anything. If you can't provide that confirmation, you know what happens. A second voice. Older, male, ragged at the edges. The voice of someone who had been scared for a while and was past the point of hiding it. I don't have anything to do with the transfer. I told them that from the beginning. That's not how they see it. I don't care how they see it. I provided the access they asked for, I cleared the paperwork they needed, and that was the extent of— Gerald Marsh, Pruitt said. Silence. Emily's hand went flat against the wall. Gerald Marsh, Pruitt repeated, 61 years old, oncology ward, responding well to treatment. You signed his transfer paperwork. You want to tell me what the extent of your involvement was? She pushed the door open. The private suite had 1 patient bed, 1 upholstered chair, and 1 window. In the bed, attached to a cardiac monitor that was showing a rhythm she didn't like, an irregular tachycardia, rate in the low 120s, the kind of presentation you saw in elderly patients under significant stress, was a man she recognized. Dr. Harlan Breck, chief of cardiology, 67 years old by hospital records, admitted 3 days ago for what had been documented as an elective procedure, which she had never questioned because she'd had no reason to, and it hadn't been her floor. Pruitt was standing at the bedside with his back to her. He turned when the door opened. His hand moved toward his jacket. Don't, she said. She said it in the register she'd learned in a different context, the one that communicated without ambiguity that the person speaking had made a prior decision about what happened next. Pruitt's hand stopped. Carter. His voice did something complicated. You're supposed to be in the basement. I heard. Breck, in the bed, was looking at her with the specific expression of someone who is reassessing a situation very rapidly. His monitor beeped. 124, bomb 126. She noted it and kept her eyes on Pruitt. Put the weapon on the floor, she said. Slow. I don't have— You put your hand toward your jacket when the door opened. Put it on the floor. A beat. Then Pruitt reached into his jacket with 2 fingers and set a compact sidearm on the floor tiles with a sound that was louder than she expected in the quiet room. Kick it toward the window. He did. She moved to put herself between him and it without taking her eyes off his center mass, picked it up, checked the chamber, loaded, safety off, which told her how this conversation had been going before she arrived, and set the safety on and put it in her scrub pocket, where it sat heavily and wrong against her hip. "Sit down," she told Pruitt, "on the floor, back to the wall." He sat. He looked, for the first time since she'd known him, like a man who had lost track of which direction was out. She moved to Breck's bedside and checked his monitor properly, ran through a rapid assessment, pupils reactive, skin clammy but not diaphoretic, respiration slightly elevated. The tachycardia was stress-induced, almost certainly. His pressure read 148/96 on the last automatic reading, 40 minutes ago. Not in crisis, but not stable either, in the way that mattered for a 67-year-old cardiac patient alone in a room with a man who had just used a dead cancer patient's name as a threat. "Dr. Breck," she said, "I'm Emily Carter. I was a nurse on this floor." "I know who you are." His voice was steadier than she expected. "You reported the supply discrepancies." "Yes. I saw your incident reports." He closed his eyes briefly. "I was on the compliance committee." She let that land, didn't respond to it directly. "Are you in pain?" "No. My chest is tight, but it's been tight for 3 days." He looked at Pruitt on the floor. "He told me they needed me quiet until the transfer was finished, that if I was a patient, I couldn't be questioned." "Who admitted you?" "I admitted myself. Elective procedure. I scheduled it when I understood what was going to happen." He met her eyes. "I thought if I was in a bed with a cardiac monitor, I would be safer. I thought they wouldn't—" He stopped. "I made a mistake in judgment some months ago, and I have been trying to assess how to address it, and I waited too long, and I understand that." "Gerald Marsh," Emily said. Breck looked at the ceiling. "The transfer was presented to me as a clinical decision. The patient was being moved to a specialized oncology facility with better resources for his specific presentation. I signed the paperwork. There is no record of the facility he was transferred to." "I know that now." His monitor beeped again. 118. Coming down slightly, which was something. "I have been trying to find him for 6 weeks. I haven't been able to locate the facility. I don't know if he's—" He didn't finish. She thought about Gerald Marsh, 61, responding well to treatment. She put it in the same place she'd been putting things all night, the file she'd come back to later, if later materialized. Her radio clicked. Harmon's voice. "Carter, building is secure, ground through third. We have one cluster of holdouts, east stairwell, second floor. Where are you?" She keyed the radio. "Fourth floor east. NICU is secure, infant stable. I have 2 civilians in the private suite at the end of the east corridor, one requiring medical evaluation. I also have Hargrove Security Chief Dale Pruitt, unarmed, in custody." She paused. "And I need a federal agent up here as soon as possible, because Dr. Pruitt has some things to answer for." A pause on the other end, then, "Copy that. 3 minutes." Pruitt, on the floor, looked at her. "You were doing fine," he said. It came out almost conversational, the tone of someone trying to find ground they could stand on. "Your incident reports were thorough. You were right about everything." She looked at him. "They would have buried you," he continued. "Fuchs and Solis, they had the board. They had the documentation. You were a 14-month employee with a complaint history. Nobody was going to listen to you." "Someone listened," she said. He looked at the radio on her belt. Something in his expression shifted. Not remorse exactly, but the particular recognition of a man who had run the numbers wrong. "The DEA diversion alert, the pharmacist. And the emergency management frequency." She kept her voice even. "And the nurses I talked to. And Patricia Dunn on a gurney in the ER who kept 2 patients stable while I was moving through the building. And Tomas from facilities, bleeding in a closet on the 2nd floor, who told me there was something wrong up here." She looked at him. "You spent 11 minutes in a conference room explaining to me that nobody was going to listen. Turns out you were the one who wasn't." Pruitt didn't answer. Breck's monitor showed 112. She put her fingers briefly on his wrist, pulse strong, more regular than 5 minutes ago. She adjusted his oxygen cannula, which had slipped, and he didn't say anything, but he watched her do it with the expression of a man who had been lying in a hospital bed for 3 days, constructing his own version of this situation, and was only now understanding how far off the model had been. Feet in the corridor, she moved to the door without moving away from Pruitt. 2 tactical operators came through, rifles up, and cleared the room in 4 seconds with the economy of people doing a thing they'd done 800 times. Behind them, a third figure, no rifle, dark jacket, who looked at Pruitt on the floor and at Emily standing beside the bed and at the sidearm-shaped bulge in her scrub pocket, and took in the geometry of it with the speed of someone who had also done this a few hundred times. "Commander Harmon," Emily said. Lyle Harmon was mid-50s, compact, the kind of face that looked like it had been weathered by decision-making rather than weather. He looked at her for a moment with an expression she recognized, the slight recalibration she'd heard in his voice on the radio. "Carter," he said, "you want to walk me through this room?" "In a minute." She looked at his operators. "One of you needs to stay with this patient. He's 67, cardiac history, tachycardic under stress. He needs a 12 lead and someone who knows what to do if his rate goes back up." One of the operators, younger, built like someone who had played collegiate sports and then kept going, looked at Harmon. Harmon nodded. The operator slung his rifle and came to the bedside with the slightly awkward movement of someone switching modes, and Emily spent 45 seconds giving him a monitoring briefing that he absorbed with the focused attention of a person who understood that this was now the most important task in the room. Then she turned to Harmon and started talking. She told him about the supply logs and the badge IDs. She told him about the Tuesday pattern. She told him about Gerald Marsh and the forged transfer paperwork, and Breck's signature, and what Breck had told her about the compliance committee where her incident reports had gone to be quietly ignored. She told him about Pruitt at the ambulance bay with the command radio man, the body language, the conversation she'd partially heard. She laid it out sequentially and without editorializing, the way she'd been trained to document, what she saw, what she did, what she inferred, and on what basis. Harmon listened without interrupting. When she finished, he looked at Pruitt. "Get him up," he said to his second operator. "Zip tie him. Read him in." Pruitt stood without resistance. The operator was efficient about it. "The man with the command radio," Emily said, tall, civilian clothes, moved like senior command authority. He was coordinating the extraction. "We have him," Harmon said. "Ground floor, taken in the breach. He's being transported." He looked at her. "There are more. Upstairs and down, we're sorting through staff and non-staff right now. Fuchs was found in his office. Solis was in a supply closet on the first floor. Hiding from the cartel? Hiding from us." Harmon's voice was flat in a way that wasn't quite anger, closer to the absence of surprise. "Fuchs had a laptop. The agents running the data forensics are going to be busy for a while." The monitor beside the bed beeped. Emily looked at it automatically. 108. Coming down. She realized she was still standing in her nursing clogs on a 4th-floor corridor with a cracked sole and an aching elbow and a loaded handgun in her scrub pocket that she had been carrying for the better part of 30 minutes and should probably give to someone with appropriate authority. She pulled it out and held it flat toward Harmon. He took it, looked at her. "You went through a full cartel takeover of a hospital building with a penlight and a tourniquet. And a maintenance radio. He turned the gun over in his hand. "The pharmacist's diversion alert is what moved us. We'd had Hargrove flagged for 4 months. Your incident reports ended up in a DEA pipeline that your hospital's administration had no visibility into. But we hadn't gotten authorization to move. The diversion alert was the trigger." She hadn't known that. She'd filed the reports and then watched them disappear and built her own conclusions about why. And the conclusion she'd built was that nobody was listening and she'd have to find another way. She hadn't known they'd traveled. "Dominic," she said, "the pharmacist." "Yes, he activated the alert at 11:53. We were moving by midnight." Harmon looked at her. "Your transmission on the emergency management frequency gave us the interior picture. Nobody expected to find a person with your particular background inside the building when we got there." "Nobody expected a lot of things about me tonight," she said. Harmon's expression shifted. Not quite a smile, something adjacent. "Your 68th medical service record is flagged in our system. There's a classification marker on part of it I can't read without additional clearance, which usually means it's not nothing. He paused. Delwood PD is going to want a statement. So will we, and so will the IG's office, and probably 3 other agencies before the week is out. I know. You might want to get your elbow looked at first. She looked at her elbow for the first time since the transport van. The sleeve of her scrub top had a dark stain on it, which meant the impact had been harder than she'd thought, and she'd been bleeding slowly through the fabric for a while without noticing. Not serious, but a thing that would need cleaning and probably a few sutures and definitely would hurt considerably more once the cortisol finished leaving. She'd deal with it. Down the corridor, the NICU monitors hummed their steady rhythms. Below, she could hear the building settling into a different kind of noise. Organized, procedural, the sound of agencies and protocols moving in to replace the chaos. Voices giving instructions in English. People being moved. The machinery of accountability beginning its slow, necessary turn. And then her radio clicked one more time. Not Harmon's channel, but the internal hospital frequency. The line she'd used to call the NICU hours ago. She didn't have the second radio anymore. She'd left it in the ambulance circle. It was coming from Harmon's belt. He'd picked up her frequency somehow, or one of his team had. The radio on his belt was the one putting out the sound. A voice she didn't recognize. Male. Clipped. Not tactical. Something else. Something administrative. The kind of voice that came with a title. This is Deputy Director Calloway, DEA. I need the status on the Hargrove operation and the name of the individual who transmitted on the emergency management frequency at 0012 hours. Harmon looked at Emily. He keyed his radio, and then the lights in the east corridor went out. The darkness lasted 11 seconds. Emergency lighting kicked in at the 12-second mark. The amber strips along the floor, the same ones Emily had navigated through in the sublevel 6 hours ago, which now felt like a different version of the same night, rather than the same night at all. Harmon had his hand on his sidearm before the lights were fully up. His second operator was already moving toward the corridor junction, checking angles. Nothing. No threat. The power cut was mechanical, not tactical. She could hear the building's electrical system cycling through its failover sequence, the particular sequence of relay clicks she recognized from her first week when a thunderstorm had knocked out the main feed and she'd helped walk patients through a 20-minute outage. Generator transfer, she said. Automatic. The main feed's been running on backup since the breach. The transfer switch probably hit its cycle limit. Harmon's hand came off his weapon. He looked at her for a moment in the amber light, then keyed his radio. Echo 7 to all units, power cycling. Building is still secure. Maintain positions. Then he raised the radio to his mouth again and answered Deputy Director Calloway. Operation is concluded, Harmon said. Building is secure. All hostiles accounted for. Civilian hostages being processed for release. No fatalities. He paused. The individual on the emergency frequency is Emily Carter, former Army 68th Medical Brigade, employed at Hargrove Memorial as nursing staff until this evening. Another pause, briefer. She was inside the building when the takeover began. She ran the interior coordination from the ground up. The radio was quiet for a moment. Get her on the line, Calloway said. Harmon held the radio out. Emily looked at it, then she took it. This is Carter. Deputy Director Calloway. The voice was different up close, older than she'd thought, and carrying the specific fatigue of someone who had been awake for a long time, managing something that had gone sideways in multiple directions at once. I've been reading your DEA referral file for the last 40 minutes. I want you to understand something. She waited. Your incident reports arrived at our regional office in March. The pipeline they came through, healthcare fraud referrals, Schedule 2 diversion flags, has a processing backlog of 4 to 6 months. Your report sat in that queue. He paused. That's a systems failure, and I'm not going to dress it up as anything else. You were right about everything you reported. You reported it through proper channels, and those channels were too slow. She didn't say anything. She hadn't expected an acknowledgement, and now that she was getting one, she found it landed differently than she'd have predicted. Less satisfying, more complicated, the way real acknowledgements tended to be. I'm saying this now, Calloway continued, because there are going to be several agencies looking at Hargrove Memorial for the next year, and your name is going to be attached to the originating complaint. I want it on record, in this transmission, that you acted correctly and that the failure was institutional, not yours. A brief silence. You'll be contacted tomorrow by our field office to begin a formal debrief. Harmon will give you the details. The radio clicked off. Emily handed it back to Harmon. He looked at her with the same recalibrated expression he'd been carrying since the fourth floor, the one that had settled into something she recognized after a while as simple respect, which was different from the kind of pointed acknowledgement people gave you when they were trying to make a point about having underestimated you. This was quieter, more functional. "Let's get your elbow looked at," he said. The ground floor had been transformed in the time she'd been upstairs. The ER bay was now a processing area. Tactical operators moving through with clipboards, DEA agents in jackets with their agency lettering, Delwood PD establishing a perimeter that kept the growing crowd of news vans at the hospital's outer parking lot boundary. The patients who had been in the ER were being triaged by an EMS crew that had staged outside and moved in once the all-clear went out, and Patricia Dunn was sitting up on her gurney talking to a uniformed officer with the composed efficiency of a retired trauma nurse who had 31 years of practiced calm and was deploying every bit of it. She saw Emily come through the bay doors and said, without preamble, "Your elbow." "I know. Sit down. I've been watching you walk since the hallway." Patricia pointed at the adjacent gurney with the authority of someone who had not stopped being a charge nurse simply because she'd retired. "You're compensating on the left side. That impact was harder than you're giving it credit for." Emily sat because arguing with Patricia Dunn seemed like a poor use of whatever energy she had left. One of the EMS crew came over, a young woman with efficient hands who cut Emily's sleeve and cleaned the wound without ceremony, and confirmed what Emily had suspected. A 2-inch laceration along the posterior elbow, deep enough for 4 sutures, with bruising that was already developing into something that would be spectacular by morning. "You'll feel this tomorrow," the medic said. "I feel it now." "You'll feel it more tomorrow." While the medic worked, Emily watched the bay. The 2 armed men who had been standing at the entrance since 11:47 were now zip-tied and seated against the far wall with a tactical operator standing post nearby. They'd lost the watchful stillness of earlier. One of them had his head down. The other was staring at the ceiling with the blank expression of a man running contingency calculations that weren't coming out well. Tomas from facilities was being brought down on a gurney by 2 operators, conscious, complaining about the gurney in the way that people who had been lying in a linen closet for 2 hours complained about gurneys, which was a good sign. She caught his eye across the bay, and he raised 2 fingers in a gesture that was somewhere between a wave and a salute. She raised her chin at him. "You're good." He nodded. "Yeah, I know." Well, was. Warren Fuchs came through the bay doors in zip ties at 12 minutes past 3 in the morning, and he walked the way men like Fuchs walked when the leverage was gone, slightly ahead of himself, as if his body hadn't gotten the message yet that the situation had fundamentally changed. He was still wearing his silver tie. It was the most absurd thing Emily had noticed all night, and she'd noticed a lot of absurd things. He didn't see her until he was halfway across the bay. When he did, he stopped walking, not because the operator behind him let him, but because his body made an involuntary choice that his dignity immediately tried to override. She was sitting on a gurney getting her elbow sutured. She wasn't looking at him with triumph, and she wasn't looking at him with anger. She was just looking at him the way you look at something you've already finished processing. He looked away first. Dr. Renata Solis came through 4 minutes later, also zip-tied, and she did not look at Emily at all. She looked at the floor, steadily, with the expression of someone performing an internal inventory of every decision that had led to this moment and finding each one worse than the last. "That's all of them?" Patricia asked, watching from her gurney. "Not all," Emily said. "There's a compliance committee." Patricia was quiet for a moment. "I served on a hospital compliance committee once, 12 years ago, different institution." She looked at Solis moving through the bay. "The ones who look away are always worse than the ones who look at you. The ones who look away made the choice on purpose and knew it while they were making it." Emily didn't answer. The medic tied off the last suture and covered the wound with a clean dressing and told her to keep it dry for 48 hours, in a tone that suggested she had no expectation of being obeyed. She was right. Meth. The DEA field office had set up a mobile command unit in the ambulance circle, a converted vehicle with workstations and communication equipment that had appeared while she was upstairs and was now running at full capacity. Harmon walked her to it at 3:37, after the sutures and after she'd given a preliminary statement to a Delwood PD detective named Vargas, who had the specific energy of someone who had been dragged out of bed for a situation well above his normal operational scope and was handling it by writing everything down very precisely. Inside the command vehicle, a data forensics agent named Pressler, young, with the focused affect of someone who found the interior of a computer more legible than most human interactions, was working through the contents of Fuchs's laptop, which had been transported in an evidence bag and was now being mirrored onto a workstation. "How long has the access been running?" Harmon asked. Pressler didn't look up. "First irregular entry I can find in the dispensary logs is 14 months ago, almost to the day." He paused. "Which is about when I started at Hargrove," Emily said. Pressler looked up. "Yeah." She thought about that. 14 months of supply irregularities running alongside 14 months of her noticing them and filing reports about them. The timeline wasn't a coincidence. She'd arrived as the operation was beginning, which meant they'd been watching her from her second month, which meant everything Fuchs had said in the termination meeting about her conduct being a concern, since month 2 had a different meaning than she'd assigned to it in the moment. They hadn't been frustrated with her. They'd been afraid of her. "The badge IDs," she said. "The ghost credentials on the second-floor supply room." Pressler pulled up a file. 4 non-roster badge IDs with second-floor access. They trace back to credentials generated in the hospital's security system, which means someone with admin access to the badge system created them. "Pruitt," Emily said. "That's where it points." Pressler turned a monitor slightly so she could see the screen. "But there's a second admin signature on 2 of the credential generations. Different access level, different timestamp, someone with HR system access." She looked at the signature code on the screen. She didn't recognize the employee ID, but she recognized the access pathway. It ran through the HR compliance system, which meant it was someone with the kind of nested institutional access that came with a specific title. "What's the name on that credential?" Harmon asked. Pressler ran the query. "Solis, Renata, CMO, access level." Nobody said anything for a moment. Emily looked at the screen. She thought about Dr. Solis staring at the table during the termination meeting, not looking up, not looking at Emily. The performance of someone who couldn't afford to make eye contact with the person they were actively participating in destroying. "She wasn't just covering for them," Emily said. "She was generating the access." "It looks that way." Pressler was already pulling more files, the quick scrolling efficiency of someone following a thread that was unspooling faster than expected. "There's also—" "Hold on." He stopped scrolling. "This is a patient transfer log. Separate from the hospital's main record system. This one's in a partitioned folder on the laptop, password protected. Just got into it 20 minutes ago." He opened the file. Emily looked at the list. 16 patient names. Dates? Transfer destinations. Not facilities she recognized. Not any facility in the state medical registry she'd ever cross-referenced. The list was organized by date, and each entry had a monetary figure attached. In a column labeled simply, C. Gerald Marsh was on the list. Transfer date, 8 weeks ago. A number in the C column that made her jaw tighten before she'd consciously processed why. "These aren't medical transfers," she said. "No," Pressler said. "They're not." She stepped out of the command vehicle at 4:10 in the morning and stood in the ambulance circle in the dark and breathed the cold air for a while. The parking lot beyond the police perimeter had 4 news vans now, with cameras on tripods and reporters standing in the lit zones doing the specific kind of talking that reporters did when they had the shape of a story, but not the interior yet. She could see the hospital's main entrance from where she stood. The lobby lights on, the tactical team's vehicles parked at angles that blocked the drive. The organized movement of agents and officers and medical staff that looked from a distance like order and from up close was still mostly controlled chaos. 16 patients. 16 people transferred out of a hospital where they were receiving care, transferred to locations that didn't exist in any official registry, with dollar figures attached that corresponded to nothing in any medical billing framework she'd ever encountered. She knew what it meant. She'd known what it meant from the moment she'd seen the column labeled C, but she'd let herself take 45 seconds to not know it, because some things needed a few seconds of not knowing before you were ready to carry them correctly. Harmon came out of the command vehicle behind her. He stood beside her for a moment without speaking. "Organ trafficking," she said. "That's the working theory." His voice was flat, the flatness of professional control over something that wasn't actually flat. The dollar figures correspond to black market pricing for surgical tissue. The patient profiles, most of them are in a specific demographic range, pre-existing conditions that made them vulnerable, limited family contact. Whoever was running the selection criteria knew what they were looking for. "Breck," she said. "Cardiology. He'd have access to patient profiles across multiple wards." "We're looking at him." A pause. "He cooperated tonight. That'll matter to someone, depending on what his actual level of involvement was." She thought about Breck in the bed with the cardiac monitor, looking at the ceiling while Pruitt threatened him with a dead man's name. Either a man trapped by something that had gotten larger than he'd realized, or a man performing being trapped well enough that she'd read it wrong. She'd been right about most things tonight. She didn't know if she'd been right about him. "The 16 patients," she said. "Is Marsh? We don't know yet. The FBI is running the destinations against every facility and transport record in 3 states. It'll take days." He paused. "Some of them may be findable. Not all of them." She heard what he didn't say. She held it and kept her face still. "Carter." Harmon turned to look at her. "The preliminary case file is going to list you as the individual whose internal reporting initiated the DEA referral chain. That means your name is going to be in every document that comes out of this. The arrests, the warrants, the civil proceedings, the medical board reviews. This is going to be a long case, long and public." "I know." "You might want a lawyer." "I might." She looked at the news vans on the perimeter. "How much of this gets out tonight?" "Enough. The arrests will be public. The trafficking element will be managed. The FBI will release what they release when they're ready. But the hospital takeover, the arrests of administrative staff, that's already out. Someone on the Delwood PD side talked to one of the reporters 40 minutes ago." He paused. "Your name's going to be attached to the interior coordination. It's already in the preliminary Delwood report." She looked at the cameras. She'd spent 14 months in a building where the people with the titles had decided she was the problem, and she'd spent tonight inside that building doing the job she'd been trained to do. And now the building was full of federal agents, and the people with the titles were in zip ties, and someone on the other side of a parking lot was pointing a camera at the ambulance entrance. She felt tired. Not the useful, functional tiredness of a body that had spent its resources and needed to refill. Something deeper, the tiredness of a person who had been fighting the same fight in the same direction for long enough that winning it didn't feel like the opposite of the fight. It felt like the absence of something she'd been carrying so long she'd forgotten it had weight. "I need to check on a patient," she said. Harmon blinked. "You're not. You've been relieved. The medical staff is—" Breck's tachycardia. She was already moving toward the entrance. His monitor was showing irregular rate when we left the 4th floor. "The operator I briefed is competent, but he's not clinical. I want someone who knows what they're looking at with a 67-year-old cardiac patient under significant psychological stress." Harmon watched her go. She could feel him doing it. "Carter, he called." She stopped. "When you're done up there, I need you on the record about what you heard Pruitt say to Breck. All of it, specific language and sequence." He paused. "It matters for the trafficking charge. What he said about Marsh, that's implicit knowledge. That puts Pruitt inside the patient selection process, not just the security cover." She nodded. She'd known that when she heard it. She'd been holding it in the same place she held everything else she'd cataloged tonight. The things that mattered, that she'd come back to, when the immediate work was finished. She went inside. Breck was awake, as the monitor was showing 94, which was better, and the operator she'd briefed was standing at the window eating a protein bar with the look of someone who had maintained focus for 3 hours and was now running on snacks and stubbornness. He nodded at her when she came in. Rate came down about 30 minutes ago, he said. Stayed in the 90s since. He asked for water, and I gave him water, and he hasn't asked for anything else. Good. She checked the monitor properly, ran through the same assessment she'd done the first time. Pupils, skin, respirations. All improved. She adjusted the head of the bed 2 degrees and noted that the previous reading on the automatic BP cuff had been 136/88, which was still elevated but trending in the right direction. Breck watched her through the whole thing. When she was done, he said, "The other patients." She looked at him. "The transfers." His voice was steady, but his hands, on top of the blanket, were not. "I signed the first 2. I believed what I was told. After the second one, I had questions. I went to Fuchs." He stopped. "He told me the facility was operational and properly licensed, and that I had nothing to be concerned about. That was 6 months ago. And after that? I didn't sign any more transfer orders. Solis took over the paperwork." He closed his eyes briefly. "I didn't report it. I was going to. I kept finding reasons to wait." She looked at him. He was 67 years old, and he was afraid, and he was trying to give her something that would make the thing he'd done weigh less. And she didn't know yet if the thing he'd done was small enough to weigh less. "There are 16 names on that list," she said. "Did you know all of them?" "Some." "Gerald Marsh?" "Yes." His voice went flat. "Gerald was my patient originally. Solis asked me to generate his treatment summary for the transfer. I thought I was providing continuity of care documentation." He opened his eyes. "I know how that sounds." She didn't tell him how it sounded. That wasn't her job tonight. "The DEA will want a full statement," she said. "Everything. What you signed, what you were told, what you suspected, and when, in sequence. Don't make it better than it was, and don't make it worse." She looked at him directly. "If you cooperate fully, what happens to you next is a legal question. If you don't, it's a simpler question." He nodded. He looked, for a man his age with a cardiac history who had just spent 3 days in a hospital bed engineering his own protection. Very old. Not in a physical way. In the way of a person who had arrived at the end of a long detour and was now looking at the thing they'd been avoiding seeing. She left him there and went back to the corridor. The 4th floor was quiet. Below her, the building's machinery was running. Agents, evidence, logistics, the slow grinding work of accountability that would occupy the next year of multiple agencies' resources. Upstairs, the NICU hummed. Tomas was being sutured somewhere on the 2nd floor. Patricia Dunn was probably still talking to the uniformed officer, getting every detail right. She stood in the corridor for a moment in the amber emergency light. Then her phone, returned to her by a Delwood PD officer 40 minutes ago, retrieved from the office where Pruitt had left it in a desk drawer, logged as recovered evidence and then released to her when Harmon confirmed her status, buzzed in her pocket. She looked at the screen, a number she didn't recognize, local Delwood area code. She almost didn't answer. Then she did. "This is Carter," a voice she didn't know. Male, older, speaking carefully, the way people spoke when they weren't sure of their reception. "Ms. Carter, my name is Lawrence Marsh, Gerald Marsh's son." A pause. "The police called my mother an hour ago. They said there's been a development regarding my father's transfer. They said the nurse who reported it, that the nurse was named Carter." She put her hand on the corridor wall. "That's me," she said. "They said they might know where he is." His voice broke at the edge, controlled back, broken again at a different place. "They said they're trying to locate him and that it might take a few days, and they told my mother not to get her hopes. They told her the situation was complicated." A long pause. "I just wanted to, I didn't know who else to call. They gave me your name, and I just..." He stopped. "Did you know? Did you know what they were doing to him?" She pressed her back against the wall. "No," she said. "I didn't know the full picture until tonight. I knew something was wrong with his transfer. I reported it 3 times. She stopped. Then, "I'm sorry it took this long. Is he alive?" She thought about what Harmon had said. Some of them may be findable. Not all. The FBI was running records. It would take days. She thought about what she owed Lawrence Marsh, who had called a stranger at 4 in the morning because someone had given him a name. "I don't know," she said. "The investigation is active. The agencies involved are serious, and they have everything they need to find him. I can't tell you tonight what I don't know yet." She made herself hold the next part for a second before she said it, to make sure she meant it and not just the version of it that was easier to say. "But I will tell you the truth when there is truth to tell. If you give me a number, I will call you. Not through a department, not through a press release. I will call you myself." Silence on the line. "Okay," Lawrence Marsh said. He gave her the number. She typed it into her phone with her good hand, the right one, while the left arm ached in its new dressing. She ended the call and stood in the fourth-floor corridor of Hargrove Memorial Hospital and looked at nothing for a long time. Then she looked at the time on her phone screen, 4:22 in the morning. Then she looked at the list of incident reports she'd filed. She had them in her phone's photo library, every page she'd photographed before her system access was revoked. And she opened the third one, the one about the second-floor supply room and the ghost badge IDs and the after-hours access pattern. The one that Fuchs had told her the appropriate parties had reviewed and found unremarkable. She scrolled to the bottom. Her signature at the foot of the document, dated 8 weeks ago, and beneath it the compliance coordinator's received stamp. And beneath that, in the lower margin of the document, something she hadn't seen when she'd photographed it. A handwritten notation, small and cramped, in an ink color that was slightly different from the body of the document. 3 letters. Initials. And a date 2 days after she'd filed the report. She looked at the initials, R.S. Renata Solis. She expanded the photo with 2 fingers and looked at the notation more carefully. Not a received stamp, not a standard annotation. A note that someone had made after the fact, on a document that was supposed to be in a compliance file, in handwriting that matched the signature she'd seen on the patient transfer orders. A note that said, in 3 words beside the initials and the date, something that transformed every conversation she'd had in that conference room, every careful diplomatic phrasing Fuchs had used, every explanation they'd given for why her reports had found nothing. Handled. Do not forward. She stood very still. Then she screenshotted the notation, time-stamped the screenshot, and emailed it to the contact address on the DEA field office business card that Pressler had given her 40 minutes ago in the command vehicle. The email sent at 4:24 in the morning. At 4:25, her phone rang again. Not a number she recognized, not a local area code, a federal area code, Washington, the district, the kind of number that didn't call nurses at 4 in the morning unless the situation had moved to a level where the people making decisions had gotten significantly larger than the people who'd been making them 6 hours ago. She answered. "Carter?" said a voice she'd never heard before, carrying the weight of someone who had been awake as long as she had and had considerably more infrastructure behind the tiredness. "This is Assistant Director Nolan, FBI. I've just been read into the Hargrove situation by Deputy Director Calloway's office, and I've been looking at your DEA referral file and the preliminary field report for the last 20 minutes. She waited. "We've located 11 of the 16 transferred patients," Nolan said. 9 of them are alive. 2 are not. A pause, the weight of it carried and set down in the space of a sentence. "Gerald Marsh is among the 11 we've located." She closed her eyes. "Is he alive?" she asked. "He's alive." Another pause. "He's in a facility in a neighboring state, in a condition that's going to require significant medical attention. We have people moving to him now." He paused again. "I'm telling you this directly because your name is on 3 formal complaints that were the originating documentation for this case, and because you spent 3 hours inside that building tonight making decisions that—" He stopped, started again. "What I'm telling you is that Gerald Marsh is alive, and I wanted you to know that before anyone else told you." She stood in the corridor with her back against the wall and her sutured elbow in its dressing and her phone in her right hand, and she did not make a sound because some things didn't need a sound. "Thank you," she said. "Don't thank me yet," Nolan said. "The FBI is formally taking primary jurisdiction of the trafficking component of this case. That means you're going to be talking to us in about 4 hours. I want the full record, incident reports, your observations tonight, everything Pruitt said in that 4th-floor room, everything Breck told you, the photo evidence on your phone, and the notation you just emailed to the DEA field office." He paused. "Especially that last one." "I'll be here." "I know." A beat. Carter. The notation on the compliance document, handled, do not forward. If that holds up to forensic document analysis, that's obstruction. That's Solis directly suppressing a legally required compliance report. He paused again, and something in the pause felt deliberate, like he was choosing the next sentence carefully. "But the document you photographed is in your personal phone's camera library, not in any official system, which means the chain of evidence is going to depend very specifically on when you photographed it, how, and what you can document about the circumstances." She understood what he was telling her. "I photographed the incident reports on the afternoon of my termination," she said, "before my system access was revoked. I can provide the metadata on every image, timestamp, device, location. The file properties will show the origination date." "Good." He didn't say "I thought so." He didn't have to. 4 hours. Harmon will set up the debrief location. He ended the call. She lowered the phone. The fourth-floor corridor was quiet around her. Below, the building worked through its new business. Above, the NICU monitors ran their soft rhythms in the dark. She looked at the photo on her phone again, the notation in the corner. 3 words and a set of initials that had just become the most expensive marginalia anyone had written in Hargrove Memorial's history. She was still looking at it when she heard the elevator at the end of the corridor open, and out of it stepped a man she had never seen before in a suit that was too good for 4 in the morning and carrying a briefcase that had a legal services tag on the handle. He looked at her, looked at the document on her phone. "Ms. Carter," he said, "I'm Theodore Vance. I represent Hargrove Memorial Hospital's Board of Directors." He paused. "I need to speak with you before you say anything further to any federal agency." He was smiling. The patient-practiced smile of someone who had spent a career arriving at situations like this with a briefcase and a plan. She looked at him for a long moment. "You should talk to Commander Harmon," she said. "His command unit is in the ambulance circle. He can tell you who you need to speak with." "I'm not here to speak with Commander Harmon." He took a step toward her. "The board has concerns about the nature of the allegations being—" "The board," she said, "should have read my incident reports." She put her phone in her pocket and walked past him toward the stairwell. Behind her, Theodore Vance said something further. She didn't stop. She'd spent 14 months trying to get the right people to read the right documents. She was done explaining what they said. Theodore Vance called after her twice. She didn't break stride. The stairwell door closed behind her and she went down, 1 floor at a time, her good hand on the railing because her left arm had stiffened enough that the elbow didn't fully cooperate anymore. And she thought about the board of directors sitting somewhere at 4:30 in the morning, getting phone calls that were dismantling everything they thought they'd built. She thought about Vance's briefcase and his smile and the specific calculation behind both, the institutional reflex of people who responded to exposure by immediately trying to reshape the narrative before it fully formed. She'd given them 14 months of chances to read the narrative correctly. She was out of patience for the reshaping. Harmon was in the ambulance circle when she came through the ground floor. He was talking to 2 FBI agents whose jackets said field office, not tactical, the kind who arrived after the guns went away and the document work began. She waited until he was between sentences and then told him about Vance. He looked at her for a moment. Then he told one of the FBI agents about Vance, and the FBI agent made a call, and 4 minutes later, Theodore Vance was being escorted out of the building by a Delwood PD officer who explained to him with the courteous flatness of someone reading from a script they'd used before that the building was an active federal crime scene and that anyone present without cleared access was subject to removal and possible obstruction charges. She didn't watch it happen. She'd turned toward the command vehicle before the escort started. The debrief took 4 hours and 11 minutes, and it happened in a conference room at the Delwood field office that smelled like burnt coffee and recycled air. FBI Assistant Director Nolan was there by phone, 2 federal prosecutors on a conference line, Harmon in person, and a document specialist who photographed every image on Emily's phone with the focused care of someone handling things that had weight in a legal sense, not just a personal one. She told it in sequence. Beginning to end, no editorializing, no interpretation volunteered that wasn't requested. The incident reports, what she'd observed about the supply discrepancies, the patient transfer pattern, the meeting with Fuchs and Solis and Pruitt, the basement, the breach, what she'd done, and how and why, what she'd heard Pruitt say to Breck, what Breck had told her, the supply room access log, the panel van, the radio transmission, the notation on the compliance document. When she got to the notation, one of the prosecutors interrupted for the first time. Handled. Do not forward. Yes. In the margin of a formal compliance report that was legally required to be forwarded to the State Health Board. Yes. A pause on the conference line. And the document specialist has confirmed the timestamp on the photograph? The specialist looked up from his workstation. Photograph was taken at 4:47 p.m., 8 weeks ago. Metadata is consistent. Device timestamp matches cloud backup timestamp. Another pause, longer this time. Ms. Carter, the prosecutor said, I'm going to tell you what that notation means in a legal context. What Dr. Solis wrote in the margin of that document constitutes active obstruction of a mandated state reporting requirement. It places her inside the conspiracy, not adjacent to it. That's the difference between a compliance failure and a criminal act, and the handwriting analysis we'll run in the next 48 hours will determine. I know what it means, Emily said. A brief silence. Yes, the prosecutor said. I imagine you do. The arrest went public at 7 in the morning, which was when the Delwood DA's office released a statement that named Warren Fuchs, Renata Solis, and Dale Pruitt as among 11 individuals facing federal charges, including criminal conspiracy, healthcare fraud, obstruction of mandated reporting, and facilitation of human trafficking. The command-level cartel operative taken in the ground floor breach was named separately in a DEA release that went out 15 minutes later. The hospital's board of directors issued a statement at 7:43 that began with the phrase deeply concerned and contained no names and no specifics, and was clearly written by Theodore Vance or someone like him. By 8:15, 3 board members had issued separate statements that contradicted the first one, and by 9 a.m., the State Health Board had suspended Hargrove Memorial's operating license pending investigation and appointed an emergency oversight administrator. Emily didn't read any of it in real time. She was eating a breakfast sandwich in the field office break room and trying to make her left arm work well enough to unwrap the foil without asking for help. She managed it on the 3rd try. Harmon came in at 9:20 and poured the worst coffee she'd ever smelled and sat down across from her. Fuchs gave a statement this morning, he said, through counsel. He's characterizing his role as administrative facilitation with incomplete knowledge of the criminal component. He knew about the patient transfers. He knew about the transfers. We can prove he knew about the transfers. Whether he knew about what happened to the patients at the destination is going to be a question for a jury. He drank the coffee without reacting to it, which suggested either he'd been drinking it long enough to stop noticing or he had no functioning taste receptors. Solis hasn't given a statement. Her lawyer is here. What about Pruitt? Harmon looked at his cup. Pruitt gave a full statement. Names, dates, transaction records, the internal communication chain with the cartel's procurement contact. He's looking for a deal and he brought enough to negotiate with. He paused. He included a statement about tonight, about walking you to the basement. He said, and I'm quoting from the summary, I put her there because I knew what she was, and I knew she'd be a problem if she was anywhere she could see what was happening. Emily set down the breakfast sandwich. He's not wrong, she said. No. Harmon looked at her. He's also not getting the deal he wants. What he provided covers the cartel side. The trafficking documentation puts him inside a federal statute that limits prosecutorial discretion. He paused. He's going to prison. The question is for how long? She thought about Pruitt walking her down to the basement, one hand lightly on her elbow, the way you'd guide someone through a door, the practiced courtesy of a man who had made a decision and was implementing it with professional calm. She'd read it as contempt at the time. Now she understood it as something more complicated, the specific care you take with a problem when you're afraid of it. She picked up the sandwich and finished it. But Gerald Marsh arrived at Delwood Regional Medical Center at 11:40 in the morning, transported by federal medical escort from a facility 2 states away that had been operating under a false medical license for 8 months. He was malnourished. His treatment had been interrupted for 6 weeks. and he had a secondary infection that needed immediate IV antibiotics. He was, according to the attending who received him, weak but oriented, and when his wife came through the door of the receiving bay, he said her name. Emily learned this from Lawrence Marsh, who called her at 11:52. He said her name, Lawrence told her. His voice was doing several things at once and not fully managing any of them. That was the first thing. He just said her name. She was sitting in her car in the field office parking lot. She'd planned to drive home 40 minutes ago and had not yet started the engine. Good, she said, which was inadequate, and she knew it was inadequate. And she said it anyway because it was true, and because the true thing was more useful than the right-sounding thing. The doctor said his prognosis is they think they can resume his treatment once his condition stabilizes. They think the cancer hasn't progressed as much as they feared. Lawrence stopped, started again. They said it matters that he went back into treatment quickly, that the window wasn't closed. She didn't say anything. You filed those reports 8 weeks ago, Lawrence said. 14 months ago the first time, she said. 8 weeks ago was the third one. A long silence. I don't know what to say to you, he said. You don't have to say anything. She meant it. Take care of your father. She ended the call and sat in the parking lot for a while longer. The morning had gone bright and cold, the specific quality of early light that came after a night that had lasted too long. And the field office building behind her was doing its institutional business in its institutional way. And somewhere across the city, a hospital was in the process of being dismantled and rebuilt by people with federal authority and no personal stake in it, which was probably the right way to do it. She thought about what Pruitt had said. I knew what she was. She'd spent 14 months at Hargrove not entirely knowing what she was, in the civilian sense. She'd come out of the service good at a specific set of things and with a specific set of instincts, and she'd tried to fit them into a building where the institutional logic ran a different direction, and when it hadn't fit, she'd assumed the problem was the fitting rather than the building. She'd kept filing reports. She'd kept believing the machinery would eventually work the way it was supposed to work if she pushed the right levers in the right sequence. She didn't believe that anymore, not in the same uncomplicated way. What she believed now was something less comfortable and more functional, that the machinery didn't run itself and that the people who kept it honest weren't the people with the titles. They were the people willing to be the problem when the titles stopped working. That being dismissed and being wrong were not the same thing, and that the difference between those two states was often the only leverage an honest person had. She started the engine. The state medical board revoked Renata Solis's medical license on a Thursday, 6 weeks after the night at Hargrove. The revocation hearing lasted 2 days, and the testimony included Emily's incident reports, the compliance document with the handwritten notation, the forensic confirmation that the handwriting matched Solis's signature on 43 other hospital documents, and the testimony of Dominic, the night pharmacist, who, had it turned out, been documenting his own concerns in a personal log for 3 months, and had copies of everything. Solis's attorney argued that the compliance notation was ambiguous, that handled referred to an internal review process, that do not forward was a standard administrative notation for documents undergoing active internal resolution. The board was not persuaded. Warren Fuchs's federal trial date was set for 8 months out. The charges included conspiracy, healthcare fraud at a scale that qualified for RICO consideration, and complicity in the trafficking operation. The prosecutors had found, in the data forensics of his laptop, a communication thread that placed him inside the patient selection discussions, not adjacent to them. His attorney issued a statement calling the charges politically motivated and factually unsupported. The statement was notable mostly for what it didn't address, which was everything specific. Dale Pruitt entered a guilty plea on the DEA conspiracy charges and received a sentence of 11 years, reduced from the potential maximum because of his cooperation. The reduction was contested by 2 of the victims' families, whose attorneys filed a brief arguing that his cooperation was self-serving and incomplete. The brief was not successful, but it was entered into the record, and it would be there when Pruitt's sentence came up for review. The cartel operative from the ground floor breach, whose name, when it finally cleared the federal identification process, turned out to be Eduardo Cardenas, with an Interpol file that covered 3 countries and 9 years, was extradited on trafficking charges that went well beyond Hargrove Memorial. The Hargrove operation was one node in a network that the DEA and FBI spent the following year dismantling in pieces. Cardenas entered the federal system and did not come back out. Of the 16 patients transferred through Hargrove's shadow system, 9 survived and were recovered. 5 were confirmed deceased prior to the investigation, their deaths now reclassified from natural causes to homicide and added to the indictment. 2 remained unlocated for 4 months and were found eventually, 1 alive, 1 not, through international cooperation that the FBI's trafficking unit characterized in their year-end report as the most complex recovery operation the unit had run in a decade. Gerald Marsh resumed chemotherapy in the 4th week after his recovery. His oncologist, working with the records Emily had flagged in her original incident reports, reconstructed his treatment history and determined that the 6-week interruption had been damaging but not terminal. His prognosis at the 6-month mark was, in the attending's careful clinical language, cautiously optimistic. Lawrence Marsh sent Emily a text message the day of his father's first post-recovery treatment. He's in the chair. He's complaining about the chair. I've never been so happy to hear him complain about anything. She read it twice and put her phone in her pocket and went back to what she was doing. The DEA's commendation ceremony was not what she'd expected, which she supposed was the point of having expectations. She'd expected something formal and institutional. A room with flags, a person behind a podium, a handshake, and a certificate and a carefully worded citation that transformed the messiness of what had actually happened into something presentable. It was partly that. There was a room and a podium, and Harmon standing to her left with the expression of someone who had looked at a situation and made a correct call and was at peace with that. There was Deputy Director Calloway, who was taller in person than she'd constructed from his voice, and who shook her hand with the grip of someone who had read her file and was making a point of it without making a production of it. But there were also other people in the room. Tomas from facilities, his flank healed, wearing a jacket that looked like he'd borrowed it from someone a size larger and hadn't had time to return it. Patricia Dunn, seated in the second row because her hip replacement put standing for extended periods in the category of things she did when she chose to, and not because a ceremony required it. Dominic the pharmacist, who had the slightly dazed look of a person who had activated an emergency protocol 6 weeks ago and was still processing the downstream consequences. And Lawrence Marsh, in the back row, with an older woman beside him who had the look of someone who had come a long way in a literal sense and in every other sense as well. Calloway read from the citation. She heard her name and the words exceptional conduct and critical intelligence and decisive action under duress, and the specific citation language that turned 4 hours of running through a building on adrenaline and institutional knowledge into something that could be read aloud in a federal building. She stood at the podium when it was her turn and looked at the room and thought about what she actually wanted to say, which was not the same as what was expected. The reports I filed, she said, all 3 of them. They were correct. They identified the problem. They documented the evidence. They went through the right channels to the right offices. She paused. They were also ignored, suppressed, and used as evidence of a pattern of disruptive conduct in my termination meeting. The room was quiet. I'm not saying that to relitigate it. I'm saying it because I think the reason I'm standing here isn't that I did something extraordinary. It's that I did something ordinary. I told the truth repeatedly through the systems that were supposed to receive it. And when those systems failed, I found another way. She looked at Dominic. The pharmacist activated a diversion alert. That's a protocol that exists for exactly the reason he used it. The reason it worked is that someone built that protocol and maintained it and made sure the receiving end was functional. She looked at Tomas. The facilities engineer who built the maintenance tunnel map in my head spent 20 years in a sub-level that no one else bothered to learn because they didn't think it was interesting. It was interesting. It was the way out and the way through for everyone in that building. She looked at the back row, at Lawrence Marsh and the woman beside him. 7 people did not survive what happened at Hargrove Memorial. 7 people whose names are in a federal indictment now, which matters, but doesn't change the 7. She stopped. I want to say that clearly, in a room full of people talking about what went right. Some things went right. Some things went wrong long before any of us were in a position to make them right. And the difference between those two categories is usually not capability. It's whether the people responsible for the systems were willing to be honest about what they were seeing. She stepped back from the podium. The room was still quiet for a moment. Then Harmon started clapping, which was not the restrained professional acknowledgement she'd expected from him. And the room followed, and Patricia Dunn in the second row did not stand because her hip made that a choice. But she put 2 fingers to her mouth and whistled in a way that suggested 31 years in trauma nursing had cured her of any inhibitions about making noise when noise was warranted. She left the DEA field office at 3 in the afternoon with the commendation certificate in a tube under her arm and the specific lightness of someone who had been carrying a weight long enough to have stopped consciously registering it and had now put it down in a way that was permanent. Harmon walked her to the parking lot. The IG's office is looking at reforming the compliance report forwarding protocol, he said. 6 to 12 months, they think, before new regulations go into effect. They should talk to the night pharmacists, she said, and the facilities staff, the people who actually see the building. I'll pass that on. He paused. What are you doing next? She'd been thinking about that for 6 weeks. The answer had been assembling itself the way answers assembled when you weren't forcing them, incrementally, from the parts you already had. There's a federal healthcare fraud investigation unit, she said, out of the HHS Inspector General's office. They embedded clinical staff in the investigative team starting about 2 years ago. Nurses, pharmacists, people with floor experience who can read institutional patterns the way agents read financial records. She looked at him. I applied 3 weeks ago. Harmon looked at her with the same recalibrated expression he'd been carrying since the 4th floor of Hargrove Memorial, the one that had settled a long time ago into something clean and uncomplicated. They'd be idiots not to take you, he said. They said the same thing, she said, in nicer language. She started to turn toward her car, stopped. The 7 who didn't make it, she said. Their names are in the indictment. I want to make sure they stay there, not as footnotes. They will be, Harmon said. I'll make sure of it personally. She nodded. She got in the car. She drove home through the city in the afternoon light, and she thought about Pruitt saying, I knew what she was, and she thought about what she actually was, which was not a hero in the way stories made heroes, and not a victim in the way systems made victims. She was a person who had looked at something wrong and said so, repeatedly, through every available channel, and when the channels closed, she had found the maintenance tunnel version of every channel, and she had kept going because stopping had never seriously presented itself as an option. That wasn't courage in the cinematic sense. It was stubbornness with good instincts and a maintenance map. It was also, she had come to understand, enough. The world didn't change because extraordinary people did extraordinary things in extraordinary moments. It changed because ordinary people with specific knowledge refused to let the specific wrong thing stand when they were the ones positioned to see it. The gap between those two framings mattered. It mattered because extraordinary was something you either were or you weren't, and most people looked at that category and placed themselves outside it. But I see this. I know this is wrong. I am going to say so again. That was available to anyone willing to pay the cost of saying it. The cost was real. She wasn't going to pretend otherwise. She'd paid it in a basement and in a termination meeting and in 14 months of being the nurse who wouldn't let it go. She'd paid it in the way people looked at her in meetings, in the record that now followed her professionally and would require explanation for the rest of her career. She'd paid it, and she'd do it again, and she knew that about herself now in a way she hadn't entirely known before. Her phone rang on the seat beside her, the HHSIG field office number. She answered it. Carter, said the voice on the other end. This is Supervisory Agent Delgado. We've been reviewing your application. We'd like to set up a formal interview at your earliest convenience. Tomorrow works, she said. A pause. Most applicants ask for a week. Most applicants haven't had my week, she said. A beat. Then a sound that might have been a laugh, kept short. Tomorrow at 10 then. We'll send the location. She ended the call. Outside the windshield, the city ran past in its ordinary way. Traffic and storefronts and people going about the business of afternoons that had no federal crime scenes in them. No tubes of emergency lighting. No decisions that had to be made in 6-second windows with whatever happened to be in your scrub pockets. She drove through it with her sutured elbow on the door rest and the commendation tube on the passenger seat and the understanding sitting quietly somewhere behind her sternum.